So you're level-headed, right? So you're bringing your head back. It's hard to talk. And you're giving yourself a double chin. Let me show you guys. What's up, you guys? Welcome back to the channel. Thank you so much for being here. This is Be Well with Dr. D. If you don't know me yet, my name is Donna. I have my doctorate in physical therapy, my master's in theology, and my bachelor's in health sciences. So I'm all about all things health and wellness and just being well. If you have not yet, don't forget to like this video, to subscribe, to share this video with someone who might be having neck issues, and spread the word about this channel. It really, really helps support this channel. So let's just dive right in. To prelude though, disclaimer, I'm not your physical therapist. I'm not your healthcare provider. Please go see a healthcare provider or medical professional for any questions or issues you might have, especially if it concerns bowel and bladder issues or extra sharp pain. Please go to an emergency room. Please go see someone for anything that you might be going through. So let's just dive right in. Again, not the most fun topic and not the most fun thing to go through, but it's so common. It's probably the most common diagnosis or issue after back pain. After back pain, it's neck pain that people have issues with. I personally have it. I've had it for a very long time, on and off. It affects both young and old, pregnant, not pregnant. It affects a lot of people all the time. So neck pain can be mechanical or non-mechanical. So mechanical has to do with the anatomy, the structure, so the bones and the joints and the muscles and the ligaments that are in your neck. Maybe it's a muscle pull or a tendon tear. Maybe it's just wear and tear of those bones in your neck. Maybe it's poor sitting posture. Maybe you're hunched over on the computer, or maybe you're on your phone all the time, so your neck is facing down all the time, leading and resulting to imbalances. Or maybe the cause of your neck pain is non-mechanical and it's a deeper and underlying physiological issue. For instance, something like osteoarthritis or rheumatoid arthritis or meningitis. Other causes could be stress. Stress can actually be a very, very big cause of neck pain and tension, or even something like a back issue. If your low back is off, if you have issues in your low back, that could actually be causing an imbalance in your neck. So if you have had, or if you currently do have neck pain, you might be feeling something like tightness or tension in your neck, in your shoulders, in your upper back. You might have sharp or shooting pain. You might have headaches. You might have numbness or tingling in your shoulders or down your arms or in your fingers. And again, please, you don't want this to lead to nerve damage, so please go see someone for this. If and when you do go see a provider for your neck pain, they will likely do a checkup. So again, going through your medical history, your family history, they'll do a physical checkup. They'll check your arm, your neck, your back, different parts of your anatomy. And you might be referred to go get imaging. So you might be referred to go get an x-ray, an MRI, a CT scan. You might be referred to go get an EMG or a nerve study or even some blood work. And of course, you want to know how to treat it, right? So some treatment techniques might involve exercise, which I'll go through some in a second, and/or pain management with drugs or creams or gels. You might be referred to a chiropractor, a physical therapist, an acupuncturist, and you might also receive trigger point therapy to release the tension or even mobilizations to release the pain. All those aside, I want to give you guys 10 exercises that can really help alleviate your neck pain. These can be done 5 or 10 minutes a day. These can be done when you have neck pain or when you don't have neck pain to prevent neck pain from happening. I honestly personally have been doing a bunch of these every single morning, especially because of the pregnancy and just neck muscle tightness and whatnot, and especially even if I'm doing a bunch of computer work. If I go through like an hour or two of computer work, my neck gets really tight, and so I do these exercises to relieve some of that tension. So what you want to achieve with these stretches and exercises is to bring blood flow to the area. Do some of these exercises to sort of balance out the imbalances that might be there in the muscles, and then also lengthen out those muscles that might have gotten really tight. So the first exercise is shoulder rolls. So you're just rolling your shoulders. Very simple, very easy. You can go 10 times forward, 10 times back, just to kind of, again, bring blood flow to the area and loosen things up. The second exercise is squeezing your shoulders up. So squeeze them up and hold them for about 10 seconds and release. So again, hold it for about 10 seconds and release. This feels really good because it feels like you're just gathering all that tension and then letting it go. And you can do however many of those you feel comfortable with, or about 5 or 10 of those. The third one is bring your chin to your chest, holding it for about a second or two and all the way back up. And then going through this about 10 times. So the fourth exercise builds off the third one. So this one, when you are bringing your chin down to your chest, add some pressure and hold it again for about 10 seconds now. And release, and you can go back and then repeat again. Hold it for 15 seconds if you're comfortable with it. And you can repeat that about 10 times, but again, you're building up. So you can start off with just doing it maybe 2 or 3 or 4 times and then build up to 5 or 10 times. So the fifth one is called scapular squeezes. Your scapula are the 2 little bones that are kind of on the top of your back that feel like wings on the back. So what you want to do is keep your elbows close to your body, bend your elbows, and just squeeze. Squeeze the 2 sides of your back to each other. And what I like to have some patients or some people imagine or picture is if you had a sponge in middle of your back on your spine and you're trying to squeeze, and it's a wet sponge, you want to squeeze all the water out of that sponge by bringing your elbows back. And I love this one. This one feels so good. People do this one when they're getting up out of the chair, out of the couch, or from the computer. But again, this one you want to hold. You don't want to hike your shoulders up, but you want to keep them low and loose and relaxed. And you want to squeeze, again, hold it for 5 to 10 seconds and relax. And same goes for these. Start with just a couple of them, as many as you feel comfortable with, and work up to 5 or 10 at a time, even up to 20 at a time. So number 6 is chin tucks. So this will address some of the the imbalances in your neck muscles and some of the tightness that could be coming from the back of your neck. Sometimes when the back of your neck is tight, then this part, the front, becomes loose. So you want to strengthen these front muscles by doing this chin tuck. So it's not the most flattering, but I'll show you guys forward and a side view. So you're basically just bringing your head, so you're level-headed, right? So you're bringing your head back, it's hard to talk, and you're giving yourself a double chin. Let me show you guys. So from the side, your head is just going straight back. So you want to be able to hold this again for maybe 2 or 3 seconds. Try to go maybe 3 or 4 times in the beginning because it can be difficult, and work your way up to holding it for a couple seconds longer and doing this for more repetitions. So number 7 is adding resistance to when you bring your neck forward and backwards. So what this looks like, you can use 1 or 2 hands. I like to put 2 hands on the back of my head and then bring your head back, and you want to provide resistance both ways. So for instance, I'm going to start like this, and I'm going to start by bringing my chin to my chest. While I'm doing that, I'm pushing my hands against the back of my head. So the back of my head is trying to resist me from bringing my chin to my chest. And now again, you push, and now it's trying to resist me from bringing my head up. So you're kind of working those muscles. I'm pushing my head back as my fingers are pushing against my head, and I'm bringing my chin to my chest. And again, I'm pushing my head down. So if I were to not use my muscles, it would just push my neck down. But what I want to do is push, again, with a little bit of resistance. This does not have to be strong resistance. I want to just push a little bit down, but at the same time, creating counter pressure and lifting my neck up. So same thing goes with forward. So you want to do that the same way going forward. So you're pushing against your forehead, and your arms, your hands don't want to let you bring your chin to your chest, but you are pushing through. Again, it's not super crazy to where you give yourself whiplash, but you're just giving yourself a little bit of counter pressure, a little bit of resistance as you bring your chin to your chest. And again, you're pushing again, and your head wants to help you. Again, bring your neck up, bring your chin up, but you're going against it as you bring yourself up. So be careful with that one. You don't want to give yourself too much pressure, too much resistance, but you want to do the same going side to side as well. So again, you're pushing, you're trying to, my hands want to push my face this side, but I'm going to use my neck muscles to turn my face to the side. And then same thing, I'm pushing against my chin, or you can use, again, just your cheek. You want your muscles, your neck muscles, to overrule your hand. So even though my hand is pushing me across, I'm still tightening and using my neck muscles to resist it. And then same thing on the other side. So again, my hand wants to keep me from turning my neck, but I'm pushing against it with some slight resistance. It does not have to be a strong resistance. And I'm pushing against it. And then same thing. Now my hand wants to push my neck back, but I'm not letting it push my neck back. And then you come back to center. So number 9 is a stretch where you look down to your pocket. So you could consider it as looking down into your pocket or to your armpit area. You want to look down and then with your hand provide some pressure down. And then again, hold it for about 15 to 20 seconds, slowly come back up, and then either do that side again or look down on the other side. So again, looking down to this armpit or this pocket, and I'm bringing a little bit of pressure to the back of my head to stretch that back part of the neck. And then number 10 is another stretch, but you side bend. So for this one, you want to make sure that your face is looking straight at first. You don't want to go like this. You don't want to go like this. You want to make sure that your face is looking straight, and then you're just bringing your ear to your shoulder so that you're going to feel a stretch right across the top of your shoulder. Again, you don't have to. You can provide some pressure to get more of a stretch through that side of your neck. And then release, again, 10, 15, 20 seconds, whatever you're comfortable with, and then do the other side. And this one feels so good. They all feel really good. So I hope these help you guys out. Let me know if you try them. Let me know what you think about them. Again, there are so many other exercises and stretches that are helpful, but these are just a few of them. Thank you guys so much for watching, for sticking with me. Don't forget to subscribe, to like this video if you enjoyed it, to share it with someone who might need it, to comment your thoughts below. And again, thank you guys so much for everything. Be well, have joy, and I will see you in the next video. Bye-bye.